on Tuesday, that would be, saying this.
Look, he wants to play all sides of the equation. Well, I was surprised. I was surprised by his answer, actually, because it's just, to me, it's not an acceptable answer, especially when it comes to schools.
He was talking specifically about Fauci's the perception, and I think this was more reporting than it was reality. The perception that he is opposed to the reopening of schools in the fall. He expressed concerns. He suggested what the science is. He suggested what some of the downsides are. He also, under a back and forth from Senator Rand Paul, reminded people, as did Rand Paul, the limited scope of Fauci's expertise, and he provides recommendations, and then the actual policymakers, the people elected, make the policy decisions.
And President Trump mentioned Purdue by name, saying that he spoke with Mitch Daniels and that Purdue plans on opening, they'll have not large lecture halls. And we had Mitch Daniels on to talk about that. And even the president of University of Illinois is planning on having in-person school in the fall.
We'll return to that topic, but right now we're pleased to be joined by JaRon Smith again. He is the Deputy Assistant to the President and Deputy Director of the Office of American Innovation. JaRon Smith, thanks for joining us again. Appreciate it.
Thanks for having me, Amy and David. Hope you all are well.
I'm Dan, but David, I'll take David too.
Dan, I'm sorry.
That's all right. That's all right.
I like David Prof.
No,
it's got a ring to it.
No. You're a doctor. Just everybody's a doctor today. You just call me Doctor Dan, Dr. David. So one of the points that you've made recently in terms of a communique from your office there, the Office of American Innovation, and has been made from the dais as well by President Trump and other officials, is the efforts the administration is undertaking as part of the holistic response, specifically targeting communities in urban centers, communities that suffer from economic blight, specific populations that are being disproportionately impacted because, frankly, they have a disproportionate percentage of comorbidities and other challenges. Speak a little bit to what the administration is doing.
Sure. So the president has already had an infrastructure that existed. In 2018, he signed an executive order that created the White House Opportunity and Revitalization Council. And that council was tasked with helping to revitalize the most distressed communities across the country by leveraging opportunity zones. About 3 weeks ago, the president announced that he would have the council, which is chaired by Secretary Carson, renew its efforts and focus on the recovery of our most distressed communities from COVID. And since then, the team has broken up into 3 different work streams, one on economic development and entrepreneurship, another on community empowerment, which is focused on public health, and then the last one on education and workforce. And so since that council's coming together, we've put about $2 billion into community health centers. Also have executed about $60 billion worth of carve-out funding for entrepreneurship and minority-owned businesses, which is helping these institutions weather the storm. And so we're continuing to be active by figuring out the best way to work with localities to help empower the most distressed communities.
Is there anything in there about testing in distressed communities? Because I know they have a lot of these drive-through centers, but a lot of people that I even know too, they don't have cars. They're used to taking public transportation, so it's hard for them to, they have to find a friend or rent a car to go through these drive-through testing centers.
Right. So we have about $11 billion to help states and territories and tribes to help them meet their testing goals. And that's a very great point that you just identified. Localities are different. That's why we're working with the states, and we need the partnership of local leaders to figure out how to best meet local needs. But that's certainly a huge part of it. And then the administration is also sending about approximately 12 million swabs to each state over the course of May.
Can I just make this point and get your reaction? The focus on minority communities, the description of them as underserved communities, they're disproportionately impacted by COVID-19. Actually, Tony Fauci had tackled this at a previous White House briefing, saying, look, we've got a disparity in life expectancy we've known about for generations. This is not new. And of course, because you have a higher incidence of diseases like diabetes in, say, the Black community, you're going to have a higher incidence of mortality in those communities. That's a systemic issue that the country has to deal with that extends well beyond COVID-19. And it just seems to me that the way we talk about this is not quite the whole picture. Underserved communities, distressed communities, they haven't been underserved or distressed because of lack of government spending in those communities. They're underserved or distressed by private sector businesses. They're underserved and distressed because they haven't had access to quality schools that provide them the opportunity to earn an education that can put them on a path to being successful entrepreneurs. So, I mean, it just seems to me that it's a reminder that the recovery really comes through the private sector. You know, government can facilitate, government can provide disaster relief, government can fill the gaps that state and local government isn't filling in this time of crisis. But I wish the conversation would extend out to be a little bit broader about what we have and haven't been doing for generations in these neighborhoods and communities that make them more vulnerable today during this pandemic.
Dan, I think you're exactly right. It's all about a whole of America approach with revitalizing and helping our most distressed communities recover. Because every locality is different. Rather, you're talking about rural parts of the country, and if you go to certain states like Mississippi and South Carolina, those rural areas are this is a majority rural African American neighborhoods versus Detroit, and so having a holistic, a whole of America approach would encourage us to figure out what's the local solution to local problems and creating an ecosystem, and that's what this council is really all about. We're constantly talking to a number of different localities and trying to figure out what's the strategy. How can we partner with the private sector? How can we bring back industry? How can we create more access through partnerships with the private sector, with the nonprofits, with the churches? Because with a whole America approach, we can really revitalize and help this country recover really quickly.
And the other thing, too, is interesting, just in terms about economic vitality leads to healthy living. I mean, that's
Correct.
really the disparity we're talking about.
That's exactly right.
And so Will Riley, who's African-American professor of poli-sci at Kentucky State University, historically a Black college, he's done some number crunching. And frankly, when you control for income, there is no disparity between Black and white. But that's the important point. So you start with a disproportionate spread in income among people, among Black versus white, otherwise similarly situated. So the income disparity drives the health disparity, the vulnerability disparity, and I think those dots need to be connected for the American people.
That's exactly right, and that's what the president has really been focused on, is giving every American a chance at the American dream. That's why jobs is a strong focus for this president, and a return and a recovery in any community will be figuring out how we can bring manufacturing and the higher paying jobs back to those communities, because there's certainly a correlation between health and wealth, which is why we have a council with 18 different agencies that cover all different types of segments, so that we can take a holistic approach towards rebuilding these communities.
He is JaRon Smith, Deputy Assistant to the President, Deputy Director of the Office of American Innovation. JaRon Smith, thanks again for joining us. Appreciate it.
Thanks so much, Dan.
Take care.
Thank you. And he joined us on our turnkey.pro answer line.
Connect with Dan and Amy on the AM 560 The Answer mobile app. Just text the word app to 64636 to download the app today.
Townstone Financial is synonymous with great rates, low closing costs, and phenomenal service to the thousands who have completed purchases and refinances with us since 2002. Hi, my name is Barry Sterner, owner of Townstone Financial. Let's hear from Jim, who just completed a no-cost refinance with Townstone Financial.
I would recommend Townstone to anybody, and I do. I always knew where we were. I knew the dates. I knew when I had to have information. There was no fire drills. The overall experience was, off the charts. I've not experienced, there's very few companies that I've encountered that really deliver that customer experience, and that's what sets you guys apart, hands down.
Remember, nobody values your business more than Townstone Financial, and I'm always available to answer your questions. Call me now at 312-896-2110. That's 312-896-2110, or go to townstone.com. That's TOWNSTONE.com.
Townstone Financial is licensed in Indiana, Michigan, Wisconsin, Florida. NMLS 136639. www.nmls.com.